Everybody's grabbing something to eat. So as you've seen, you have a pretty tight schedule, so I know everybody's grabbing and settling and, feel free, but during, I would like to introduce you to my friends Melissa, Karen, and Danielle. And we are going to have a discussion about advocacy. And they will introduce themselves and we'll just start chatting. And this is meant to be a discussion for everybody. So I will be walking around as you have questions, comments, raise your hand, yell to me, I'm Suzanne. And I'll make my way over you with my nifty microphone.
Yeah, I think everyone already knows who I am. I'm Melissa. Let me just get a shout out. Is everybody having a good day so far? Yes. Right? Learning a lot of stuff, meeting some new friends. Very cool. Okay.
Okay, so I'll take this moment to introduce myself. My name is Karen Correa. I've been in the industry of clinical trials and drug development for 27 years. And I know you don't believe me. I actually started when I was 5, just in case you're wondering. But I'm an advocacy, more importantly, for rare diseases, oncology, and I'm very, very important into clinical trials and drug development because I know that's what's the new future. So I'm just excited to be here. I'm also a member of the board of Central South Jersey, Komen. Thank you.
Hi, my name's Danielle Pantalone. I started my career in Washington, D.C., working on the Hill for a member from Ohio, where I handled healthcare from a legislative perspective. And then after we decided to leave, where I also got my master in public policy degree there, and then sort of switched to the other side, working in advocacy. And now I'm the director of stakeholder and media relations for CCG. And in that role, I work with so many different advocacy organizations, most often in the oncology space, like Komen South Jersey, which is an incredible organization. And I work directly with advocates like you to assist in surround sound issues and different legislative issues, especially patient access, making sure patients can access the medicines they need, the treatments they need, things like that.
Okay. So we're going to start off with some questions, but we want to make sure that you know that this is for you as most importantly. So please ask questions, anything that you can think of, or something that you wanted to ask or wanted to know, or something you want to share with someone else as well. Okay, so I'm going to start off with you, Melissa. I know you've had the opportunity to speak to the audience and give a lot about your story. I think what's interesting for me is to hear what you've been through and what you do as a professional and as a mother, and then, working in this space. How do you balance all that as a...
Yeah, I think, number one, let's just ground ourselves. If you live in the state of New Jersey and you have a family and friends and you also get sick, that is tough because, Jersey's not an easy place to stay alive in, right, without being sick. For me, the first time when I got sick, my kids were young, and I am a very transparent, open book, and I wanted to be the same way with my kids because I think it helps. The more you sort of are out front and talking about it, I think it takes the fear away from it. And so we were very open with my kids. We got ourselves, I'm a big planner, and I'm very visual. So we did a big calendar, like a 12-month calendar from Staples that you can put on the wall, the dry erase. And every treatment, every radiation, the surgery, the recovery, we use those as opportunities with the kids to sort of make big X's through so that my kids could see the beginning of something, but they also knew that we were working towards the end of each phase. And I think that really helped my family sort of process things as opposed to it being secretive or a very nebulous, scary thing.
Okay. So I just want to take a little bit off of that. You said something about you're an open book. I think that's probably hard for some people to be as transparent about their story. So what advice do you have for someone about sharing their story? How to maybe get to that stage if they're not there yet, and what benefits have you seen from doing that?
Yeah, and I absolutely recognize that there are extroverts and there are introverts in the world. And you probably already can guess I'm much more on the extrovert side of the pendulum, but I respect and love my introvert sisters immensely. For me, I have seen firsthand the fact that I am talking about a taboo subject. I'm talking about cancer and all of the yuck that comes along with it out loud. I have seen what it does to others and what it does for others. There's a way to have your voice be heard, and it's not necessarily on the stage and being an extrovert. We're very lucky that we live in the digital age that we live in, and any single one of us can become a blogger like by this afternoon. You know, you don't need to go to school for it or anything, but by telling your story, you are actually giving this freedom, this refreshing feel to maybe just the one person that heard or read your story. And you have absolutely no idea how powerful that is to that individual. And it's contagious. It's like if you tell someone and they tell someone and so on and so on. It's very contagious to share stories. If any of you have had children, I would say this. Think about when you were pregnant and if you went to those Lamaze classes or when you were sitting in the waiting room for your obstetrician. And you always had that one person, whether it was you, typically it was me, or the other person sitting there who would start talking. Like, oh, and how are you doing? How are you feeling? How far along are you? Is it your first baby? Oh, do you have any heartburn? Maybe that baby's going to have hair. I mean, and just think about if it was your first kid when you were sitting in that room, you thought, oh, they get me. They know what I'm feeling. And I can now start talking about some of that stuff. I really feel it's no different, but it's, you know, we think it is, but it really is no different.
That's really good to know. It's interesting. One of the things that I always hear, and I mean, some of you probably know the quote, they say that your test is your testimony. And so that's really important for people to understand that when you go through something, you can utilize that, and that voice can be powerful to the next person. So even though they might not say anything when you're telling them, they're listening, and then that can be transferred to someone else. So taking that power, we want to know what can we do with it. So Danielle, tell us, what can someone do by sharing their story? How impactful is that with legislators and, you know, from a federal or a local level?
So it's the most impactful thing you can do with your story. By sharing it with a legislator, you can impact legislation that could directly affect your life, whether it be through out-of-pocket costs, which we all know the cost of healthcare skyrockets every day, and it's very frustrating. But by you sharing your story with the legislator, they can then take that and use that story to hopefully minimize out-of-pocket costs, cover oral chemo treatments, things like that that impact your daily life. So there are many opportunities there. And as Melissa touched on, also from a social media perspective, all legislators are now online. They all have Facebook pages. They all have Twitter handles. You can tag your legislator in a tweet about your situation, and they may reach back out to you and want to know more. You can post on their Facebook wall your story and what is happening with you, and then they might want to schedule a meeting with you. There are so many ways that you can share your story with different political appointees, whether it be your local city councilman or your congressman in DC.
So I'm going to tap on that just a little bit. I know sometimes there are people who are not very knowledgeable in social media. That might not be their space. So what are some other opportunities that you could see someone being able to reach out to the legislators? What do they say? How do they reach out? Can you have some steps on how to do that?
Just social media or other ways too?
Just other ways outside of social media.
Oh, yeah. Well, you can always email your legislator. That way it's not a direct contact. I'm sure everyone has an email address. You're able to find those publicly in New Jersey online if you want to contact your legislator. You can work directly through Komen. Komen's extremely active in the advocacy space. If you feel comfortable sharing your story, you can go work with one of the wonderful women there and say that you want to get involved, and they can help put you in contact, whether it be setting up a meeting for you. You can go in person and meet with them. You can make a phone call and just share your story through the legislative aid that way. But there are many different avenues, and it doesn't have to be directly through you. Use the resources you have available here through Komen, and I'm sure they could help you as well.
And I'll even touch on that. My oldest nephew is going to be graduating with a political science degree. So he interned for 2 years with Frank Pallone's office. And he was amazed. He would come home every day and tell these stories. Well, he's a young person, so he was amazed that people still use a telephone to get in touch with people. So that was one amazement for him. But the other amazement, because he was the aide, he was the intern that took the phone calls. And so for him, he would come home every day and tell us these stories about, wow, the passion that exists around our state for all these various topics that somebody is really, really interested in ensuring that either Frank Pallone knew about, or how do they get more information from what's going on in Frank Pallone's office, and how do they get more involved? So the phone is active, my friends.
You kind of led into it when you said that about your nephew. So I was just getting ready to tap into that. So it's something about, someone going through something and they're telling their story. But it's nothing more interesting as well as someone advocating for you and telling your story. Maybe a child or a sibling or someone of that nature, kind of how Komen started when you think about it. So you want to give us some advice if, I know there's caregivers and stuff like that, maybe how you would talk to them about how to be able to tell someone else's story and how to go about that.
Well, yeah. I mean, look, I think us as patients, we have a rough road to hoe. But if any of you out there are the caregivers, your road is just as rough because you have undying love for that person sitting next to you, and you also feel helpless. But the way that you can really empower yourself and that person that you're caring for is to also find ways to tell the story. There are so many groups out there for caregivers, but as a caregiver, you put yourself on the lowest rung of the need, right? We just do that anyway. But to get out and to talk about what you see and how you care and how sometimes you do feel like maybe you're a gerbil on a wheel and nothing's really happening, and am I even making a difference? That's a very important story to tell, because that will resonate with people that are feeling the exact same way. There is immense power in the idea that the world is small and that we are all really not so different from each other. There's a crazy amount of power in that.
Okay, so we've asked a couple of questions here. I do want to make sure the audience has a chance to ask questions, but before we do that, I just want to make sure, is there anything specific, Danielle, that you want to talk about with what you've done, in this space that might be something that'd be impactful that I didn't ask?
Sure. So one thing I didn't touch on was media. Obviously, you have tremendous opportunity, whether it be through TV news or in print, doing an op-ed. Those are other ways you can share your story and to share how this disease specifically has impacted you, or if you're a caregiver, the challenges you're facing, again, to get the word out there about what people are going through and hopefully impact change.
I would have to echo that. So one of the things I want to leave with, I'm sure we had a great time today. I hope that when you do leave here that you share what you've experienced so this event can just grow and that we can get more people to understand the power it is with us coming together and sharing our experiences, sharing our knowledge, and being able to ensure that everybody's informed. As we are more informed, we make better decisions. And that's what's more important for us as for patients and for patient caregivers. And so we do want to make sure we take that opportunity, Suzanne, to get questions from the audience as well, if there are any.
Yeah, I was wondering, within the audience, has anybody had any success or examples of how they have been an advocate on any level? Did somebody raise their hand? Oh, thank you.
Hi, thanks. I was just wondering, I've been involved in the past with the Reach for Recovery program, which is through the American Cancer Society, and I'm sorry I didn't get a chance to really research Susan G. Komen, but do you guys have programs like that where there's someone who is a survivor and they can reach out one-to-one to someone who's been newly diagnosed and share their story that way?
So I can probably answer this best. So we do. So we have a
Suzanne, why don't you repeat the question, because I think it was a little soft.
She asked if we have a program within Komen that once you're diagnosed, if you wanted to connect with somebody, and talk with them. So we have a couple different outlets. Number one, I can tell you that our office in Central and South Jersey, we're out by Princeton, we're all over the place, and I know many people in the room can attest that we get calls regularly, and that's really what we do. So, people know that, at the very core of what we are, we're a resource, and that people can call us, and when they have questions, when they need something, when they, need a wig, or they have a wig that they want to be able to, give to somebody, that's what we're there for. And then on a national level, we have a helpline that they take every kind of call. So whether you're a caregiver and you have a question about, what my mother, my sister, my whatever is having this issue, how can I help? Or I just have a question about this kind of treatment. I want to know about this clinical trial. We have all sorts of resources. But I can tell you that, we're here, we're local, and anybody that needs anything, that's what we're here for. And I believe I had a conversation with somebody just before that, this is what we do. We connect people. So hopefully that answered your question. Has anybody else reached out to a legislator, or maybe you guys can talk also, Danielle, maybe you could talk about some of the bills that we have worked on, like together, or change that we've really pushed, because I think it can be overwhelming thinking about what is it, this is what's going on. I don't realize it's happening for other people too. What kind of change can we make?
Sure. One example right now in the legislature is the out-of-pocket cost bill, where they've been working for, I believe, like 6 years on this legislation. It comes up every session, but right now in this moment is the furthest it's ever made it. And overall, what it's trying to do is just cap what a patient has to pay out of pocket. And there are certain numbers that they've negotiated. Obviously, there's a lot that goes on behind the scenes. But the real driver of this legislation has been patients and patient advocacy organizations. There's an out-of-pocket coalition in New Jersey, which Komen is a part of. And they, as all the different organizations in the cancer space, in the rare disease space, you name it, they're a part of the coalition, and they've gone in to meet with legislators and share their individual patient stories as to why these caps need to be in place. So, if you're interested in getting involved today, let me know, and we could absolutely plug you into those efforts. But that is a really great example of how all different types of organizations and all different types of patients have come together to really impact change at the state level. And then also oral chemoparity, which I'm sure you've heard about previously. That's where oral chemo drugs, which is a very typical treatment for breast cancer patients, were not covered in the same way that intravenous oral chemo drugs were. And the Affordable Care Act left it up to the states to determine how they wanted to handle that. So each state individually has had to pass protection so that oral chemo could not cost more for the patient than infusion would, and an injection would. And that is another one where patients led that effort to make sure it was passed and shared their stories as to why they shouldn't have to pay more out of pocket for a drug to treat their cancer than any other patient who has cancer should.
So Melissa, you want to tell us anything more about how that impacts the patient, or how patients learn about stuff like that? How did I know it's probably easier for you just being in the industry, but what advice would you give to a patient to learn about all of these types of things that are going on? Because I think sometimes it's like you don't know what you don't know, and you don't even know where to go and look for that type of information. So I think that's kind of maybe if you know a resource process.
Yeah, well, I think it's not very highly scientific, but for me, and I'm sure many of you, you do not go to your doctor without a notebook and a folder, or if you're young and hip, your phone, right? And I won't. I won't. And I mean, look, I've had and been managing through my cancer since 2012, and I will still go with the notebook. And it is a partnership with your oncologist and you. And he'll tell me stuff. I'll stop him. I'll write it down. And I will I will go and I'll read, I'll look at things on the internet, not too much, because I think we can all go down a rat's hole, and we can either cure our disease by, like, I'm going to eat tree bark and I'll be cancer-free by tomorrow, or we can say, holy shit, I'm going to be dead in 4 fucking hours. I just read this, right? So we got to pace ourselves, guys. Got to pace ourselves. So I read this. I write down some notes of things that I think, well, that sounds interesting. I wonder if it's going to pertain to me, or can I get in on this? I'll put it in my notebook, and I'll bring it back to my doc. And that's how we go back and forth, because I don't have a medical license. I'll never have a medical license, although I know if you have breast cancer, you feel like you are as close to being his doctor as you'll ever be, right? But that's how I go about it.
That's a good advice. I think it's more importantly about bringing the notebook and writing things down. It's interesting. I tell people as I do a lot of health coaching, nobody knows yourself better than you. Nobody. So you go in there and you tell your story. I don't care what it means. Sometimes you got to write things down probably to remember it maybe. Yep. But no one knows yourself better than you. So you make sure that you stand up for yourself and you speak for yourself. That's really, really important. And that's kind of what we talk about when we're here. We want to share the stories, because you might talk to someone else maybe, I think, and they might say something. You're like, oh, you're right. That's exactly what I'm experiencing, or that's what I heard. So then that's why it's important to speak to someone and to talk to people and have that circle. That circle is so important for us, and we are each other's keepers. So I'm very happy for that. You want to talk about a little bit?
And one thing to piggyback off that is when it comes to these different types of access issues, there's no relationship more sacred than between a patient and a provider. And going to your provider and having these discussions and different challenges that you might be facing, that relationship is so sacred. So your provider can also be a great resource in terms of getting involved if you're having an issue with an insurance company or with obtaining something that you need. They're a great resource. And so much of this comes down to protecting that relationship.
And a shout out to the oncology nurses too, because it's the doc, but those oncology nurses are the shit. They know their stuff.
Yes, absolutely, absolutely. Right. Suzanne, another.
Do we have any other? Oh, thank you.
Hello. Yeah, very loud. I just wanted to get back to the comment about where in the state, I guess, of New Jersey, there's a bill that's been passed that says you're only
The out of pocket.
right. Because so I'm a little confused, because I, for example, was on Ibrance, and I think it was $1,000 a pill, so it was $21,000 a month. Insurance paid for most of it, and the part that they didn't pay for, Pfizer picked up. And now I'm on Afinitor, and similarly, the insurance company is paying some of it. Novartis is paying for some of it, but then, and this is my first experience with having to pay out of pocket, but I'm going to have to pay about $10,000 or $12,000 a year. So, what is that cutoff? Like, how does it work in terms of how much the state will pick up?
I can't answer that specifically given your health plan. This legislation would only impact specific state-run plans, obviously not every insurance. So I'm not exactly sure how that would work with your medication.
So is it, and I'm just learning about it too, so it's a good question. So what you're saying is the state passed something that if you're not on insurance.
No, so they haven't actually passed it yet. It's just in the Senate. Yep.
We are totally passing rumors in this room right now.
Yeah, sorry. I mean, it has gone as far as it has ever gone, which was through one chamber. So we're hoping, though, come, I think, June 3rd, they're supposed to have a hearing to hopefully pass the bill. The governor's hopefully ready to sign it. So that's as far as it's gotten. But that is something, if we wanted to connect after, I'd be happy to put you in touch with the sponsor of the legislation. And he could, I'm sure he'd love to go through how all the specifics would impact what you're going through. I just can't answer it off the cuff.
Yeah.
Look at that. You came here and you're leaving an advocate.
It was meant to be.
It was meant to be.
Sorry, she had a question that I'll come back to.
Up here, Suzanne.
Oh, sure, my friend Kelly. Trying not to run.
Suzanne's getting some Zumba in.
I sure am.
Hello. My name is Kelly, and I was diagnosed with late-stage triple-negative breast cancer last year. I saw something recently on News 12 that was kind of alarming. For someone like me who has triple-negative, no history of breast cancer in my family, do not have a single mutation in my gene pool, they came out with some good news that, as we all know, dense breasts more likely to hide breast cancer. But the part that really kind of got my fist shaking was they said that legislation is thinking about changing the age from 45 to 50 if you're only at the age, saying if you don't have the cancer in your family, you don't have the BRCA mutation. And for someone like me, that just makes me crazy. Like I said, I was diagnosed at 33. I thought I had an older woman's disease. Thankfully, I got cancer while social media is such a big prevalent, and I found out from social media that there are women out there like me, my age, even younger. One of my friends is 21 and she has stage 4 breast cancer. So legislation needs to do something about people that look like me.
Oh, me thinks you're walking out of here an advocate too.
Absolutely. Share your story. I'm not sure if that was state legislation or federal legislation. I'm not familiar with that, but that's where you go directly. You make that phone call and say, I want to meet with you. Like, this would directly impact my life, and it would directly impact so many women I know. Like, this is not a challenge for just 50-year-olds. So that is where absolutely perfect for you to share your story.
And thank you for sharing.
Yes.
Thank you.
We have a couple minutes more. About 5 minutes, actually. So, or we could just eat cookies for 5 minutes, whatever. Does anybody else have something to share or question?
All the way in the back.
Oh, thank you.
Okay, I'm not sure if this question relates to the advocacy.
Ask away. There's no wrong question.
But I am currently on a clinical trial, and I always want to know about other clinical trials that fits, my diagnosis. Last time I asked that question, somebody said you could go to this website and all the clinical trials are listed. But it looks like it's in the thousands, and how do I navigate through all that? So I feel like there should be somebody that helps navigate that, and your doctor doesn't go through all those clinical trial options for you. They only have what's offered in their own institution. So I saw briefly something up on that screen that Susan B. Komen has something on the website to do that. So can you expand on what that is?
So on a national level, we do have a clinical trial website and outlet, and we do have an 800 number as well that goes along with the helpline that they can help you through that. I'm looking to see if Dr. Gorski has arrived, and she'll be here soon from MSK, and in our afternoon breakout sessions, that's what she's actually going to be talking about, is how you navigate through that, because everybody's diagnosis is different, and you go through, and how do you navigate through that? But that's absolutely something that we have. Again, we're a resource, and hopefully Dr. Gorski can even go further into that.
Self-breast exams used to be something that doctors were really advocating for, and they would tell their patients, nurse practitioners, doctors, you name it, whoever was a care provider, do your self-breast exams. That's fallen off the map. Where should it be?
Yeah, we're just saying here, know your breasts, know your girls. That was a campaign, right? feel it on the first. Yeah, there's a lot going on. I don't know. I don't know if that's fallen off the wayside because I'm so, you could talk about Suzanne. I'm so far away from that.
So at Komen, what we suggest instead of monthly self-breast exams, we really go like the Know Your Girls campaign, and if you've seen it, and for some reason I've seen it like 5 times in the last week, but that's know your body. So instead of like feel it on the first or whatever day it is, just to know your body and know what feels different. And that really, like core of it is being an advocate and being an advocate for yourself and standing up. I mean, I know probably all of us in this room have a story about whether it's yourself or a friend that went to the doctor and said, this doesn't feel right. And the doctor said, oh, it's probably fine, come back in 6 months. And they said, no, I do something, it doesn't feel right. I'm telling you, I know my body. And so that's really what our mantra now is to know your body, know your family history, and speak up. No one is gonna come and knock on your door and say, that thing that you feel, you should probably go get that checked out, and be your own advocate. Does that answer your question? Okay. I'm getting good at this in my ears. Okay.
Hi. This probably isn't the proper forum, but it's on my mind. A little over 10 years ago, I was diagnosed with a stage 1 estrogen-positive cancer. Went through the chemo, the whole bit, cancer-free, being monitored. And my biggest fear, and I know it's the fear of many women, some who are relatives and friends, is how do I know that that cancer isn't growing somewhere else? And we're all told the same thing. We don't scan the body. We don't look for cancer. We treat symptoms. Okay? That's easy for a doctor to say, okay? I was just diagnosed with metastatic breast cancer, and I had a stage 1 cancer. So, again, I know this is probably not the proper forum. Maybe I can hook up with you at the end. That needs to change.
Yeah. I think everyone's shaking their heads here because, there's nothing else to say except, it's got to change. And thank you for sharing your story. Right in the center, or you?
Okay, good.
Last question.
Yes.
Talking to that, depending on your oncologist, a lot of them do tumor markers. Although they're not scanning, if they're doing the tumor markers on a regular basis and they see a change, then they go further. So there is something that can be done. It's not as aggressive, it's not as informative, but it's something.
Yeah. Yeah, and I think that's absolutely true. I think what you were maybe getting at was you had this break. You had early stage 1. You did what you needed to do. You went on living. And then all of a sudden, X time later, how did this happen to me, stage 4? Okay. Still under the care of the oncologist. So, to her point, yeah. Okay.
But even with the markers, my understanding was given to me that the insurance companies don't necessarily allow for the testing of the markers. It's kind of, and I was told it was kind of, you kind of just wait and see first. They felt that it wouldn't make a difference whether they tested for it or not, that if you're going to get it, you're going to get it.
Yeah, I think we have, just to say and close out, I think we have a lot of advocates or advocates to be in this audience because all the things that you're all saying, I know we've all heard them. I was just telling somebody, every 6 months since 2012, every 6 months, I get a letter from my insurance company that says, yep, we're going to approve your chemo for 6 more months. I hold my breath when I see that envelope because I think I'm going to open it up and it's going to say, we're done, which I don't know what I would do at that point. So I think that we need to have our voices heard. And we do need to get active because we only have one life to live, and it should be ridiculously amazing.
Yes, thank you. So I hope this was great, and I thank you all for sharing and for listening and for being here. As Melissa and I have both said, this is our first, we hope, of many events like this annually, but we have events throughout the year where we're bringing people together so that you can share these things, that you can talk with people that understand and are going through, and you can ask questions. So I encourage you to, again, come ask us questions and get involved, and hopefully this isn't the last time we'll see you until next year. So thank you so much, ladies.